Hello and welcome to the 11th episode of the Innova Biosciences webinar series. Today's webinar, Methods of Antibody Conjugation, Which One is Best for You, discusses the benefits of using directly conjugated antibodies and the various approaches and techniques that researchers can use to make these tools in their own labs. Today's speaker is Dr. Nick G. Nick is a biochemist with over 20 years experience in the pharmaceutical and biotechnology industry and the CEO and CSO of Innova Biosciences. Nick did his PhD and leads on the development of hybridomas and the use of monoclonal antibodies to localize and purify membrane peptidases. He subsequently took up various research positions in the pharmaceutical and biotechnology sector with Merck, Warner Lambert, and Upstate Biotechnology, and has expertise in protein purification, assay development, and bioconjugation systems. Nick is the inventor of the Lightning Link antibody conjugation system. Well, that's the basics laid out. Now please welcome Nick.
Okay, hi everyone. This is what we're going to be covering today, indirect and direct detection methods, reactive groups, and cutting through some of the jargon, key methods for making antibody conjugates, key considerations before you start. And I'll put this at the end because it's easier to understand why they're key considerations if we do them here. I'll finish off with some details about Innova conjugation technologies and applications. Okay, in any talk on labeling of primary antibodies, it's worth starting here with the differences between direct and indirect detection. So on the left here, we have the indirect method where an unlabeled primary antibody binds antigen, and you detect the presence of the antigen and the primary antibody using a secondary reagent, an antibody labeled with some sort of reporter molecule. On the right-hand side, this is what we call a direct method, where the label is attached to the antibody and there's no secondary reagent. So there really are key differences there, particularly in terms of the number of incubation and wash steps. Now, why should you directly label your antibody? Well, you don't need to. You can use the indirect method, but there are some issues potentially. So in this example here, we have 3 primary antibodies, 3 different species, and then anti-mouse, anti-rabbit, and anti-goat secondaries. But in a situation where one of the secondaries cross-reacts, then you're effectively confused about which antigen you're measuring. So this antibody here is not actually reporting the presence of the green antigen. So there are some advantages in labeling the primary antibody, which is shown here. You can just see from looking at the schematic, this is so much easier to understand. And in this particular case, we've got 2 mouse antibodies, but we can accurately report the presence of the purple and red antigen without any confusion. So just to summarize then, directly labeled antibodies, why would you do that? Well, no non-specific binding from secondary antibodies, simply because they're not there. Fewer incubation and wash steps. And as a result of these 2 things, better data quality and better reproducibility of the experiments. Okay, turning to conjugation now. Conjugation of an antibody to another molecule, which is usually a label of some sort. And essentially a reactive group B on the label forms a covalent bond with a reactive group A on the antibody. Now, depending on the detail of A and B, these elements of A and B can be present in the final conjugate, or A could be missing, B could be missing, but one way or another, a link forms between the antibody and the label. Let's look at this in a little bit more detail. If we focus on the label first, the label can be an enzyme, it can be a dye, biotin, streptavidin, fluorescent protein, a particle. can be many things, and labels with reactive B groups are widely available. So a key decision, really the key question for anyone wanting to make a conjugate is, which B group do you use in your reaction? And the choice of B is really quite important because it affects in a significant way how you treat your antibody and what modifications need to be made to the antibody. Now, if you choose the right B, you can make life much easier for yourself. If you go to a bioconjugation textbook, you'll see some of these things. This is a whole list of conjugation chemicals that may help you to form an antibody conjugate. These are some of the reactive groups that you could have on your label. Lots of these things are commercially available. You don't usually need to make this reagent yourself. And any textbook will tell you about functional groups in antibodies. And this whole list of reasonably reactive groups in every antibody. To anyone who's new to this field, though, this looks pretty horrendous. But most of these possibilities, the possible reactions that you could do, really complicate what is actually very easy. Most of this you don't need to know. So what do you need to know? Well, from the list of functional groups, I would suggest you need to know about just 3 of them: maleimide, N-hydroxysuccinimide, and thiol. Just 3 chemicals out of this list. I mean, there are far more than is shown here. But you only need to know about EDC, 2-aminothiolane, and SMCC. And in terms of functional groups in antibodies, really it's just lysine, possibly glutamate and aspartate, which come as a pair, essentially groups with amino acids with carboxyl groups. Lysine is obviously positively charged. So this is not looking so bad if we cut it down to the basics. And really, you just need to understand 3 key reactions. First, the reaction of an NHS ester with an amine, the reaction of an amine with a carboxyl, and how to thiolate an antibody. And it may seem hard to believe, but you can conjugate just about any antibody to any label with just this knowledge. You don't need everything that was on the previous slide. Okay, this first reaction then. Reaction of an NH ester with an amine. These reactions are always carried out at around pH 8. The main application is labeling of antibodies with fluorescent dyes. This reaction is simple. You don't need to modify the antibody with an A group before you can actually make the conjugate. The downside of NHS esters is that they're very unstable, really sensitive to moisture, so you've got to be really careful about how you store these materials. And for those who are interested in the chemistry, here's the antibody with a lysine with the terminal amine. This is the NH ester here, and R represents any dye, say fluorescein. But this could be more or less anything, and this part will be constant. And effectively, the amine reacts with this molecule. The NHS is pushed out, and the dye becomes attached to the lysine through an irreversible bond. So probably 80% of bioconjugation reactions involve this sort of chemistry, and the only thing that differs is what you have here. Okay, second key reaction. Reaction of an amine with a carboxyl. These reactions usually carried out at pH 6. Main application here is labeling of antibodies with carboxylated particles. Very, very unusual that you would have a protein label with this particular approach. Again, it's simple. Again, you don't need to modify the antibody to introduce an A group before you can make your conjugate. one of the downsides with this approach is that because antibodies have lysines and carboxyl groups, you can get antibody-antibody conjugation as well as particle antibody conjugation. But this is a very popular technique. It's not a huge problem. So here we have antibody with lysine again, particle with a carboxyl. And in this, with this type of chemistry, you need another reagent called a carbodiamide. There are many of these. You don't need to look any further than EDC. Just use EDC. It's cheap, really reliable. And I've not bothered showing the chemistry of this. There are some fairly complicated reactions here and intermediates. You really don't need to worry about that. All you want is your conjugate, and it just pops out at the end. The particle is effectively become attached to the lysine group. Again, really simple chemistry. Don't need to complicate it with lots of functional groups you've never heard of before. Okay, third reaction that I think is important. How to thiolate an antibody. Okay, the reason we do this is so you can react antibodies with maleimide activated protein labels. Downside of this approach is that you need to modify your antibody. That means you're going to have some separation steps to remove excess reactants at the end. But anyway, let's have a look how we do this. There are lots of thiolation reagents. It can again be confusing, but you don't need to look past 2-aminothiolane. Fantastic reagent, reacts with lysine groups in your antibody. Effectively, this ring opens and you attach a thiol group where previously you had a lysine. Well, what I really like about this reagent is that the final product has a positive charge, just like the original lysine. So it doesn't perturb the structure of the antibody in the way that perhaps other reagents would. Okay, at this point, I think it's worth mentioning heterobifunctional reagents. You'll definitely see this term in any conjugation textbook. It's essentially a reagent that is usually an NHS ester, which you've just seen in one of the earlier slides, connected to a B functional group. These are the groups that are attached to the protein labels. So these heterobifunctional reagents are used to produce activated labels, as shown here. So the NHS ester reacts with the amine, just like the example we saw earlier, and the B group becomes attached to the protein label. Now, as I said, these things are commercially available. You just have to decide which B group that you want. If you do have to make your own label because it's not commercially available, I would not look past this heterobifunctional reagent, SMCC. This adds a maleimide to your protein label. There are probably scores of reagents like this for attaching various groups. This is by far the best. It makes it much easier for you in terms of antibody modification if you can do the simple thiolation reaction that we just covered. Okay, let's have a look at a little bit more antibody activation procedures. As I said, they can be used to introduce A groups, which may be required for your conjugation reaction. This activation step nearly always involves lysine modification. Again, you would use NHS esters. This by now should be becoming familiar. You can use these reagents for adding bromoacetyl groups, azides, alkynes, hydrazine ligands, aromatic aldehydes. You may have heard of some of these things. They can be used to produce conjugates. You really shouldn't bother. This is complicating it unnecessarily. And with any antibody activation procedure, you will have a desalting step or a spin column to remove excess reactants. Just shown here, antibody going down the column, surplus reactants removed. It's just one of the disadvantages of having to activate your antibody. Okay, let's look at this in a bit more detail. Why should you avoid antibody activation steps? Well, you really should if it's possible to do so. If we start here, you have your antibody. It's unlabeled at this point. You want to label it. You know with certainty what the concentration is. You know how much you've got. If you have to modify your antibody before you can actually make a conjugate, then you are going to face some sort of separation step. Quite often it's a spin column. You will lose material. There's no question about that. Suddenly, before you go on to your conjugation reaction, there's uncertainty. You don't know how much you've lost. Okay, you can measure the protein concentration again. It's all very well, but you've lost material. There's uncertainty, and the next time you do the spin column, it may be slightly different. So again, you won't have exactly the same recovery of antibody. So your next conjugation reaction won't be the same as the one before. And this is an issue with all antibody modification procedures. Losses of antibody, variability, lack of scalability, and this is both up and down. So you really should choose functional groups that do not force you into unnecessary modification of the antibody. Now, I've already shown you some great chemistries, very popular chemistries where you don't need to modify your antibody. Let's just look at this in more detail again. Okay, you may have a label with a B functional group. Your choice of B may force you to attach an A to a lysine on the antibody before you can even make the conjugate. Well, this is just pointless. B could react directly with the lysine. Then you can get rid of this step, you can get rid of the spin column, you can get rid of the uncertainty. Why not just react B with the lysine? Well, you need a technology to do it. Excuse me. And ideally, you want a technology that's compatible with antibodies as you purchase them in the native unmodified form. This is where one of Innova's technologies comes in. This is something that we thought about a lot several years ago, and we came up with what we think is a great solution called Lightning Link. It's a unique one-step conjugation technology. So here we have the antibody, which is mixed with the label. This is all done in one pot. And we have a special chemical shown as a triangle here, which can't react with the label, but it reacts with the antibody to put on a reactive A group, using the terminology from earlier in the presentation. As soon as the triangles have turned into functional groups on the antibody, the label can come in and react. Once this has happened, while this is going on, triangles are designed to spontaneously convert into red circles even without the antibody. And these circles can block excess reactive groups on the label once the conjugate's formed. After that has happened, this red circles are actually designed to decay automatically to give a completely benign byproduct, which you don't have to remove. So the whole thing is just a sequence of events. Once you've added your antibody to the mixture, this sequence just goes through its steady progression, completely hands off. You just wait a set period of time and you can use your conjugate straight out of your pot. So without those separation steps, you've not lost any antibody. You know exactly what concentration you've got. You can repeat it every single time and get the same conjugate time and time again. Okay, so just to summarize then, you're simply adding your antibody to a freeze-dried mixture. Could be any one of 50 labels in this format. enzymes, fluorescent proteins, dyes, streptavidin, biotin. One step, 30 seconds hands-on time, no spin columns, so there's no losses of antibody, freely scalable. So applications, I mean, it's obviously broad with this number of labels: Westerns, ELISA, flow cytometry, immunohistochemistry. This is just an easy way of making any conjugate you might need with the minimum of fuss. This is just an example of ELISA using a conjugate made with this simple one-step method versus standard method. So performance at least as good, but the amount of effort to generate the antibody substantially less than with a traditional method. Again, the simplicity allows ease of scaling up or scaling down. So here we have conjugations at 4 scales: 50 micrograms, 500, 5 mgs, 50 mgs. The performance is exactly the same. This is because there's one step. It's always the same process. There's no variability. And you can even go down in scale. I mean, you can do 10 microgram conjugations. That's a standard product that we sell. So with your 100 micrograms of antibody, that perhaps costs you $250 or £250, you can do a trial conjugate with just 10 micrograms. It'll take you 30 seconds of time, and you won't lose any antibody. You really can't put small quantities of antibodies down spin columns and expect to get anything back. So this allows trial conjugates to be made without consuming much antibody at all. Okay, other key considerations before you begin. I've put this at the end because it's easy to understand now why these are key considerations. You've seen earlier that virtually all bioconjugation methods utilize lysine residues on antibodies. So you have to be worried if you find in your antibody some of these materials. So you're really looking out for amines, glycine and histidine can quite often be found in antibodies, tissue culture media, crudocytes fluid, azide, BSA, tris. Now, you may still be able to conjugate your antibody without having to dialyze it to clean it up, but it depends on the concentrations. You just need to be cautious. Watch out for these things, and if you pay attention at this point just on what the data sheet says, you can ensure you get a good result when you carry out your conjugation reaction. If you're doing a reaction with a carbodiamide, and we went through one of those examples earlier, you need to watch out for EDTA, or substances that have carboxyl groups, which could interfere. It's quite unusual to find EDTA in an antibody, but you just need to be aware of which functional groups are reacting, and watch out that you don't have any interfering substances. DTT, mercaptoethanol, again, rarely found in antibodies, but they will interfere with just about any conjugation chemistry. So just need to check you haven't got any of those things in your antibody. Okay, here's a summary of the easiest chemical approaches for making conjugates. We have a fluorescent dye with an NHS ester. This will react with lysine on the antibody. It's a direct reaction with the lysine, so there's no antibody modification, spin columns before you get started. So it's a great method. If you have a particle with a carboxyl group, again, it's a reaction with a lysine, this time mediated by EDC, as we discussed earlier. Again, no prior modification of the antibody required. It's a direct reaction once again. If you have a protein label, best reactive group by a mile to put on there, if you have to do this yourself, is a maleimide. You will need to put a thiol on the antibody, but we covered a simple method for doing that. So yes, there's antibody modification before the conjugation reaction. You will have some sort of separation step, but this is about the best approach you could use that involves a separation step. I hope I've convinced you today that conjugation is not that difficult. You could have a go at this yourself, but if you're still not sure, or if you're in a rush, then you could use one of our Lightning Link kits. Take your 30 seconds. You won't lose any antibody because it's all done in one pot. Okay, so the main messages then. Complex chemistries are not needed to make conjugates. You really should be able to tackle this yourself, especially if you avoid technologies that force you to modify your antibody. You can couple labels directly to the lysines that are already present on the antibody. Finally, avoid procedures with spin columns or other separation steps. You will definitely lose antibody and introduce a lot of variability. Okay, thanks for your attention today, everyone.